Miami is a city on the move. A place where the action's fast. The sports are hot. The parties last till dawn. In this city, medicine is practiced differently.
Operation Bright Star, that too.
It has to be, to keep up.
We'd like for our response times to be within seconds.
In Miami, life and death often rest in the hands of the mobile medics. In the beautiful blue waters around Miami, there are few things more treacherous than offshore powerboat racing, where speeds can reach 110 miles an hour in choppy seas. In this extreme sport, boats can spin out of control, collide, and even capsize.
Number 28 blew it over. Number 28 blew over. He started Peril Road and he blew it over.
In the last 10 years, 9 people have died in offshore racing accidents.
In the event of an accident, the race course will go underneath a double yellow flag with 2 pace boats.
That's why Jim Poplin is in charge of planning for the worst.
Pace boats will pick up the fleet and slow them down to about 50, 60 miles an hour.
Poplin is the safety director for the American Powerboat Association, the governing body that sanctions 35 racing events a year.
How'd it go, boys?
Pretty good.
His company, Stars Rescue Team, puts mobile medics on location at every race.
We haven't got him yet.
Yeah, team eliminators come in. We have divers, medics, RNs, EMTs, paramedics that travel all over the country providing safety support for offshore races.
A Stars team may include as many as 50 people, with 5 helicopters and up to 20 boats, monitoring the race at all times. In 18 years, and with more than 450 racers rescued, Jim Poplin knows that rapid response is crucial.
We'd like for our response times to be within seconds instead of minutes.
But Jim's job starts well in advance of the actual race,
He's not in. Go ahead and log him in.
because the best way to ensure the safety of the racers is to try to head off problems early, before they turn into catastrophes. It is one of the fastest and most dangerous sports on the planet. Highlight. And Miami is its epicenter. Every year, 6,000 games are played in 5 different facilities. This ancient precursor of modern-day racquetball originated in the Basque region of Spain. The goatskin ball, called a pelota, is about 3/4 the size of a baseball, and much, much harder. Players use a glove-like scoop-shaped wicker basket called a cesta to catch and hurl the pelota at speeds upward of 160 miles an hour. The game requires great agility and lightning reflexes, and injuries are common.
Highlight is a very tough sport, as you can see. I haven't sat upstairs.
Harlan Selznick is an orthopedic surgeon
They'd rather play than go to therapy, so they get
and one of Florida's top sports medicine specialists. As chief physician for Miami Highlight, he's always on the move at the Highlight Arena, known as a fronton.
The most common injuries we see in highlight are overuse injuries, shoulder problems, elbow and wrist problems, which you could see from the sport why that's common. We also see some knee injuries, some lower back problems, and the routine acute injuries, such as an ankle sprain or if someone's hit directly by the ball going 160 miles an hour, it can cause some damage.
The force needed to hurl the pelota and the repetitive motion involved take their greatest toll on the player's shoulder joints.
Shoulder injuries are probably the most common injuries we see in highlight, where a player's shoulder becomes sore enough that they can't throw the ball. They'll come to the office.
Hold your arm up that way.
Santos Sarria has a more serious shoulder injury that is going to require surgery.
Still a little sore in here?
The 43-year-old Santos has been playing professional highlight since he was 15.
There's very few people in any sport that can have that kind of longevity.
And back like you're reaching for a seatbelt now, way back.
And he's taken care of himself. Unfortunately, his shoulder today looked like he's played for over 20 years. And our goal is to try and take some of those years off the clock and hopefully get him to play at least a few more years. And I think he'll be back playing.
That hurt at all?
All will depend on the surgery about to be done on his shoulder.
Okay. Okay, just to kind of go over again what we're going to do today.
While Santos is not fluent in English,
You know, we've done everything.
he does understand the details of the upcoming procedure and how important it is to his future.
If he doesn't do this, then he can't play anymore. So that's why, you know, it does affect, so it's his last chance.
It's my last chance.
What we're going to do is first we're going to look inside the joint, look for any damage to the labral cartilage, which we think you do have based on the MRI scan and your exam.
In a few hours, Santos will know whether his career is over
Fix that problem. Look at the rotator cuff from the inside looking up. Also look to make sure...
or if Dr. Selznick has bought him some extra years on the court.
Well, everything should go great. Okay. So I'll see you in a few minutes, okay?
Miami is the world's busiest cruise ship port. 18 liners call the city home. And nearly 3.5 million passengers a year head out to sea from here. November 3rd, 2001. The Carnival cruise liner Spirit takes on supplies and passengers for an 8-day Caribbean cruise.
First of all, place the life jacket over your head.
Beginning with the lifeboat drill before the ship even leaves port. All efforts are made to ensure the health and safety of the 930 crew members and 2,200 passengers.
This ship is basically like a small town, and almost everything that can happen in a small town can happen on this ship.
Dr. John Bradbury is the ship's senior medical officer.
On board the ship, we have the full spectrum of medical situations. We have all ages on board, pediatrics, young adults, middle-aged, elderly, men, women. We have minor surgical cases, medical cases, pretty much the full spectrum.
Is it Mr. Hayden?
Yes, it is.
Dr. Bradbury, sir. Good to...
Besides Bradbury, there are 3 nurses and a second doctor on board the Spirit to dispense medical care.
We see minor cuts, lacerations, all the way up through to critical care cases involving heart attacks.
What do you see on that 12-lead cardiogram?
We have this room equipped pretty much like a hospital ICU on land. We have some cardiac monitoring equipment. We have over here a ventilator, infusion pumps, and all the sort of drugs that we would use in a cardiac arrest, and any sort of critical medical situation that requires, intensive care.
In acute cases, they can consult with doctors on land. With what's called teleradiology, they can even transmit X-rays by satellite to a university hospital for further diagnosis. Dr. Bradbury hopes, as always, for an incident-free voyage. But there is slight cause for concern. The Spirit will be skirting the edges of an offshore hurricane. Florida's year-round sunny skies and warm climate make it a popular destination for golfers from around the world. But on Naples' Grand Golf Course in Naples, Florida, this sport can be just as brutal as it is relaxing. For the people who play for a living, it's a strenuous physical challenge.
The body is not conducive to the golf swing or vice versa. We make a lot of unnatural moves.
On the course, professional golfers walk up to 10 miles and hit from 200 to 1,000 balls every day. And what looks easy isn't. The repeated motion of a golf swing can cause arthritis, tendinitis, and torn cartilage in the backs, shoulders, elbows, and hips of top competitors, like Greg Norman.
I think that we are finding nowadays that the game of golf has been really detrimental to your body. And with the torque and the rotation and the tension and pressure put on certain parts of the body, if you do that enough, sometimes something's going to snap or break, and that's when we really pay the price.
Greg has won 86 championships worldwide, including the British Open. But for almost 4 years, his ability to play golf was threatened by a troubling hip injury. An injury that also haunted him off the course.
I didn't like walking around in pain. I didn't like the discomfort, because there were times when I couldn't get out of bed. My hip would be locked up and I'd fall on the floor.
His pain was caused by a torn labrum, a rip in the cartilage that lines the hip socket.
I think the problem occurred from him being a very, very driven person. He's a golfer who practices a lot, hits a lot of golf balls, and I think it's a combination of a specific event and also overuse.
Greg played through the pain, but when he struggled during the 2000 U.S. Open, he knew it was time to do something about his injury. Greg turned to Dr. Mark Philippon, a pioneer in arthroscopic hip surgery, a minimally invasive orthopedic procedure using an optical system called an arthroscope.
Basically, this is an MRI arthrogram. It's a very, very good indicator of soft tissue injury in the hip. X-ray. What was unique about Greg's case is that his labral tear was very hard of access. It was posterior. It was in the back of his hip, so it was very hard of access. That's good.
Dr. Philippon is the director of sports medicine and hip disorders at the University of Pittsburgh Medical Center.
We'll go in, we'll resect the torn portion of the labrum.
He convinced Greg that new arthroscopic techniques and tools would be Greg's best chance.
This would need a 70-degree scope
to get back on the golf course.
He told me it was cutting-edge equipment, state-of-the-art stuff, hadn't been done a lot, especially in an athlete of high standing in their sport. He convinced me that this was the way to go.
With his next tournament just 5 weeks away, Greg opted to have Dr. Philippon perform the surgery that could save his career. For powerboat racers, the dangers are many and obvious, but some of the most serious injuries can be minimized by a simple dunk in this swimming pool. The idea is to learn how to escape underwater while upside down in an overturned boat, one of the most terrifying experiences a racer can face.
The main thing is for calming down, because if you panic inside this boat or in your boat, you're going to have a problem. A simple mistake becomes a large mistake. You look good, Pat.
Yeah, it felt good.
The thing about the dunk test is it's basically an accident simulator training. It's to teach everybody self-rescue. If we can teach them to self-rescue, then they're going to get out quicker and safer and not cause themselves any harm. Then you don't have to worry about accessing air because you're on F-16. But I want you to calm down and count to 10.
Clay Engel is the lead instructor for the STARS rescue team. the safety supervisors for American Powerboat Association racing events.
Very good. Okay, now I need you to swim down there and back.
Every racer who competes in a canopied boat must complete the test at least once a year, or he's suspended from racing.
I was involved in a serious accident when a boat flipped over, and it kind of gives you more confidence, and the more you do it, it just becomes natural to do it.
These life-saving safety techniques are known by the acronym BRACE.
B stands for brace for the impact. R, reach for the exit point. A, access your air. C, calm down and count to 10. The next thing is escape. Pop your latch and come out of the boat.
These safety measures are only a small part of what goes into keeping a dangerous sport from being even more dangerous. The safety checkups will continue right up till the moment of the race.
Also look to make sure there's no arthritic change, because you've been playing more than a couple years.
At Miami's Health South Doctors Hospital, Dr. Harlan Selznick is about to perform shoulder surgery on High player Santos Cerilla.
Surgery will probably take about an hour.
Santos's problem is a common one with High players, a rotator cuff injury. Dr. Selznick sees 4 to 5 such injuries every year.
There's 4 muscles that come together from the front of the shoulder, the top of the shoulder, and the back of the shoulder to form a tendon that attaches to the ball part of the shoulder. That tendon lets us rotate the shoulder, so it's called the rotator cuff.
The repetitive throwing motion in High can eventually thicken the tendon, so there's less room for the ball joint to move. It starts to rub or impinge.
I look better with the mask, huh? Okay, thanks.
Dr. Selznick believes Santos's problem will turn out to be correctable.
And we're going to try and widen the space, almost like raising a drawbridge, so he'll have a lot more room to move the shoulder when he goes back to play. And so that's our plan. Well, that's probably some of that cartilage tear that we were talking about before. We're going to get a better view.
During the arthroscopic surgery, Dr. Selznick can watch the procedure on a monitor while he works.
And this is an instrument that kind of looks a little bit like Pac-Man. And this kind of cuts and sucks at the same time.
He first finds several small cartilage tears.
So we've kind of cleaned out those cartilage tears, at least cleaned out the pieces that were catching between the 2 bones, that were probably irritating him some. And then you can see this bone right here that's kind of almost like a spur, and we're going to shave that down, so it's like widening the drawbridge.
Dr. Selznick works with an orthopedic surgeon's equivalent of a Swiss Army knife.
And we're just kind of smoothing, it's almost like a sander here, to make sure there's no spurs or anything that could dig into his cuff and re-inflame his bursa. Well, beautiful. Okay, and that's giving him so much more space than when we started. And now we just got to take another feel of the cuff from this side, make sure we're not missing anything, and we're done.
After the operation, Dr. Selznick is pleased.
He should be back playing in about 6 to 8 weeks, and I'd be surprised if he's not playing a lot better.
But before he can go back to playing, Santos still has to undergo shoulder rehabilitation that is often painful. It is Tuesday, October 30th, 2001, in Key West, Florida, where the American Powerboat Association World Championships will be held in 3 days. But before any boat even touches the water, it must first pass a safety test. The STARS team checks for faulty equipment that could endanger the crews and make sure all life-saving safety gear is present and working. More lives will be saved here than during the actual races.
We check to make sure that we have 2 handheld onboard fire extinguishers. Then we check to see that the seats are sturdily mounted. Check that the steering wheel does release where if we have to come in or if they get hung up for some reason, the steering wheel will release and won't get in the way.
And it isn't just the boats that get safety checked.
Just take a deep breath and blow in front of it until I tell you to quit.
The racers, too, come under STAR's scrutiny.
This morning what we're doing is our pre-race physicals. We're checking the blood pressure, pulse rate, and we're also doing a breath analyzer. Just make sure everybody's skills are ready and sharp before they go out on the water.
Rescue 1 is going to be Keith. I'm going to be the diver, and then we'll assign us a medic in just a minute.
Besides the STAR's crew,
Jordan.
Local emergency team members and medics are also recruited.
At a typical race, we have anywhere between 25 and 50 safety personnel to support us in our safety needs, which may include a combination of EMTs, paramedics, RNs, physicians, and rescue divers.
Perhaps the most crucial members of the STAR's team are the rescue divers. There will be 5 boats with 3 divers each, plus a helicopter known as Angel 1, with additional divers.
We're working the rescue for turns 7 and 8 inside the harbor. The way that the tides and the wind come in here and hit, we've had a higher frequency of accidents in this location.
The last thing to check before the heats begin is the course itself, from the air. And that is, again, Jim Poplin's responsibility.
My main concerns going into the race is, number one, the race course itself. Is the race course safe?
Right now what we're doing, we're going up what's called our insurance flyby. We're going out and checking the course, making sure that the buoys are in place. We're making sure that our support vessels are in place and that our spectator fleet is in place.
Poplin knows there will be accidents. There always are. The real question is, can they make it through the day without any serious injuries? It is the Carnival cruise liner Spirit's 3rd day at sea, and many of the passengers are uneasy. The ship is skirting the edges of a hurricane, and the heavy seas are contributing to a higher than usual amount of seasickness.
1 every 12 hours.
Yeah, she specifies to take something to eat, get herself in the fresh air as well.
Yeah, okay.
Okay?
Today we had a lot of cases of seasickness. It was probably the worst day I have seen, and working full-time for a year and a half, and then for almost 4 years part-time prior to that.
While not serious, seasickness can certainly take the fun out of a cruise. But modern medicines can usually limit its intensity. Although today, some passengers are too ill to even make it to the infirmary.
The nurse received a call from a passenger that have a guest that is too sick to be able to get up out of bed. So we're going to make basically an old-fashioned house call, or cabin call in this case.
Hey there.
Hi, Mr.
Here, you're
Peril.
not feeling
Doing
so
good.
Huh?
The lady was ill enough from the motion sickness that she was unable to get out of bed. And so we went to the cabin and administered an injection of Phenergan, the recommended medication. It's used for treating seasickness quite effectively.
Now, you should start to feel the effects of that within like half an hour to 45 minutes.
And she subsequently was doing very well. We saw her out several hours later. She was dressed and out and about having a good time.
Okay, very good.
Thank you.
You're welcome.
So far, the medical calls have been routine, but soon that will all change. As the focus turns to life-threatening emergencies. At the Trump International Golf Club in West Palm Beach, members of the LPGA have gathered for the final tournament of the season. A competition among the sport's top 30 money winners.
Get water, Jason.
And wherever they go,
Morning, Randy.
Keith Kennedy goes with them. 48 hours before the event begins, Keith Kennedy sets up the Health South Sports Medicine trailer, which he takes to more than 35 different tournaments during the 11-month season.
This trailer goes to every event that we can physically get it to on the North American continent, so even into Canada.
This 600-square-foot tractor trailer is a completely self-contained fitness and rehabilitation center.
So we have Stairmasters, treadmills, stationary bikes, free weights, all the kind of stuff that you would find that you could work out.
The trailer is also fully equipped with everything Keith might need to treat an injury.
And we are basically set up to take care of 144 athletes and whatever they happen to need during the course of the week's time.
Keith says the most common injuries are those that occur from repetitive stress on the body.
Tendonitis, bursitis, just anything that that's usually an overuse. In women, we see a lot of upper extremity injuries, hand and wrist injuries. They seem to be a little bit more prevalent with women than they would with men.
There's only one way to overcome injuries, and that's exercise.
Killing me.
Which is exactly what golfer Greg Norman is counting on as he fights his way back from hip surgery. After 20 years of hitting golf balls, professional golfer Greg Norman suffered a torn labrum, a flap of cartilage inside the hip socket. An injury that could easily derail his championship career.
First of all, I had a torn labrum in my hip, and also I had a bone spur. But where my tear was in the backside of my hip, under normal operation, it was very, very difficult to get to where my tear was.
All right, I'm gonna put this in now.
So in June 2000, Greg went in for arthroscopic surgery. That promised to put Greg back on the golf course within 2 weeks.
X-ray?
The procedure employed 2 new devices developed by Dr. Mark Philippon. The first is a flexible chisel that would enable Dr. Philippon to access the back of Greg's hip through 2 1-centimeter holes instead of the usual 3 or 4.
You can look at the tip here. I can bend it at 90 degrees. By rotating my arm like this, I can gain access to a very difficult part of the joint that normally would be hard to get at just if I had a rigid instrument.
The second device is a temperature-controlled heat probe that emits radio waves which heat the tissue surrounding the hip joint. This heat tightens the tissue, known as the capsule.
Raise our pump all the way up. So if your capsule is tighter, it helps improve the stability of the joint. And that's why the athletes really love it, because they feel that their hip is more stable. I get some from the femoral head as well, yes.
For a golfer like Greg, increasing the strength of his hip joint could help improve his overall swing.
You're looking at the torn labrum here.
Greg's procedure was similar to the one being performed today. Dr. Philippon begins by clearing away any loose tissue.
You see this here? This is a loose piece of cartilage I'm going to remove. So what we're going to do now is we'll insert our flexible instrument and we'll start debriding this.
First, he shaves away the piece of torn labrum, the lining inside the hip pocket.
We're basically vaporizing tissue. This is just like raking leaf, if you will. I'm just kind of brushing the area to remove all unstable cartilage.
Next, Dr. Philippon examines the labrum to identify other potential problem areas.
This looks very stable, so there's no chance that any part of this will get cut again or tear again. So everything is going very well.
Then he uses the heat probe to shrink the area surrounding the hip socket.
I want this tissue to be tight so it makes up for the deficient labrum to have the optimal rehab.
Finally, he removes the bone spur, which could cause further tearing of the labrum.
Okay, I'm gonna go begin.
After about an hour, the surgery is complete.
Very good, very good.
For Greg, surgery was only the first step in his recovery.
I personally think the surgery is the easy part. I really do. The hard part is the rehab, because it never ever ends. And the rehab hurts more than the surgery.
Nothing short of complete rehabilitation would put him back on the road to being a champion. In Key West, it is moments before the qualifying round for multiple classes of boats. Each boat has a crew of 2, the driver, who actually steers the boat, and a throttleman, who controls the speed. Pat Patel, the driver of the Don Q boat, and his teammate Felix Sorrellis have already gone out for a test run and are a little concerned about high seas.
What happens is in the World Championships, everybody tends to race a lot harder. So it could be more dangerous racing against the competitors rather than just the elements.
As the 2 o'clock start time approaches, the safety divers position themselves in boats.
10, 9, 8,
And Angel 1, the Star's helicopter.
5, 4, 3, 2, 1. Begin your start.
Finally, it's race time.
We are rotating now, rotating now.
As the boats churn by at speeds of more than 110 miles an hour, rescue diver David Thompson keeps a wary eye out for signs of trouble.
I'm watching and listening. You can listen to the motors and tell if there's a problem. I mean, a lot of times I'll hear a boat over here do something, and just listen by the sound of the motor can make you actually know a wreck's getting ready to happen.
But within minutes, a boat rolls over.
He blew it over. He started barrel rolling, he blew it over.
This wind has changed directions, and it's throwing them off a little bit. Inside the boat, you can't tell which way the wind's blowing because you're completely enclosed. So they're having to find what the wind's doing as they're driving, and it's much more difficult then.
The course goes under a yellow caution flag, which means the boats hold their relative positions while divers begin the rescue operation. Their greatest fear is that the crew members have been injured inside the boat as it careened over. The drivers emerge unhurt and are taken to safety, but the boat will not race again today. It takes 8 minutes to get the disabled boat out of the way and restart the race. But weather conditions begin to deteriorate. The winds begin driving choppy water, creating unsafe conditions. More boats run into trouble, and the course becomes increasingly dangerous. It is now up to Jim Poplin, surveying the race from Angel 1, to decide whether to finish or stop the race because of the hazardous conditions.
He worked hard with the therapy. Most of the guys work hard with the therapy.
Dr. Harlan Selznick, the physician for Miami High Lie,
Let's do the vertical first, and then we'll reset.
is also at the forefront in several fields of sports medicine research.
Hi, Maggie. I'm Harlan Selznick.
Dr. Selznick is helping to popularize a new FDA-approved machine called the Oscitron,
What Dr. Canizares is going to do is he's going to kind of numb up the foot.
using it to help patients like Maggie Grega. Maggie's not an athlete, but she has a bone spur in her heel, similar to what some athletes acquire.
It's been awful. I mean, I like to just walk normally, and I can't do that. I'm always, it affects the way I move, so my hips are tired, my neck gets tired.
It's not the most comfortable experience in the world because I've had
Maggie didn't relish the thought of surgery to remove the spur,
almost no side effects other than a little soreness and bruising.
but then she found out about the Oscitron.
The technical name is extracorporeal shock wave therapy, or orthotripsy. It's a similar device to what people will use to break up kidney stones with a lower energy.
Okay, here's the initial stick, okay?
Oh.
There you go. Now you're gonna feel a burn.
Wow.
The machine produces a high energy shock wave.
We're gonna start at a low level, and then we're gonna go up to the level we need. So.
that does two things. It stimulates soft tissue healing, and it also produces a microfracture of the bone that allows blood vessels to grow into the tissue and essentially heal it.
Selznick says the Ossitron has a healing rate of 75%, a significantly higher rate than traditional medications and therapy.
Well, I feel it underneath my... It was unusual. It was something I've never felt before. It was like a little zap, little zaps of, I don't know, little zaps of pressure, I guess that's what it would be. It was fine. It was tolerable, and I know, the results are going to be great.
Good to see you.
Good to see you, Dr. Selznick.
Dr. Selznick has other projects, too. He's conducting a biomechanical research study using computer modeling of the human body. He wants to find out why women athletes are many times more likely than men to suffer ligament tears to the knee.
There's been a number of different theories as to why this happens, some anatomical, some having to do with the way women land and jump.
We'll do a vertical jump.
So the goal of the study is to take a group of professional women athletes and a group of professional male athletes and compare how they land and jump.
They recruited athletes from the Miami Heat and Seoul to test in their trials. By comparing the motion and force of male and female athletes, Dr. Selznick hopes to find ways to cut down on the extent of the types of injuries that have shortened the careers of many female athletes, both amateur and professional.
If we do really find a difference in how they land and jump, try and set up a program to educate and retrain the athlete to land and jump differently, and then see if our incidence of ACL tears go down.
Make sure you're able to see. Okay, now.
With research like this, Dr. Selznick continually hopes to find new ways to treat and rehabilitate athletes with potentially career-threatening injuries.
Everybody clear? Shock. Okay, keep bagging.
What's the rhythm?
Okay, no change in the rhythm. Continue CPR. What's your first?
On board the cruise ship Spirit, emergency procedures are being performed on a dummy.
What are you going to do next, given that Dr. Bradbury's not here? What's your first drug going to be? Okay, good. Epinephrine, 1 milligram. This is something we do on a regular basis with the staff on the ships, just training scenarios where we give them different clinical problems and then take them through their resolution.
Drills like this are common on board the Carnival ships.
Good. Patient's now got a pulse.
Operation Bright Star. Operation Bright Star.
There's even a medical emergency staged monthly, codenamed Bright Star.
Overhead page throughout the entire ship will be made from the bridge. That's a sign that there's a serious medical situation on board the ship.
Operation Bright Star. Deck 2.
Hello, can you hear me?
The location is also given at the time the Bright Star is called.
While emergency medical care is given at the site,
Operation Bright
a stretcher team races to the scene.
The chief of security, he'll coordinate the stretcher team to retrieve the stretcher, run to the scene. With the guidance from the medical department, the patient will be repositioned from the floor or whatever onto the stretcher and transported to the infirmary.
3 left.
Virtually every conceivable emergency has been rehearsed by the crew and medical staff, including how a critical care patient would be airlifted from the sun deck back to the mainland.
The helicopter does not land. It'll hover over the open area, drop a cable. At that point, we would quickly bring the patient out, who is all packaged up, would be hoisted onto the helicopter, and then the helicopter would leave without ever actually touching down.
Last year, about 350 patients were evacuated from Carnival Line ships, comparable to the number of medical emergencies on most lines. Many of them were cardiac and respiratory cases among predominantly elderly travelers.
Occasionally people die. Sometimes we have people with end-stage disease processes, terminal cancer, and their last wish is they want to go on a cruise. And unfortunately, sometimes they die on the cruise.
But on this trip, the Spirit's medical crew faces no serious emergencies.
Go ahead.
Dr. Bradbury, who spent 14 years in private practice on dry land, can't imagine being anywhere else.
The medical aspect is a lot more challenging than what most people would predict. We do get serious cases, even critical cases. But in terms of lifestyle, it's fantastic. Basically, I get paid to be on this ship to do a lot of the same things that people pay to come and do.
How are you? Very good.
At the Health South Doctors Hospital, Dr. Harlan Selznick has finished repairing Santos Cerria's shoulder. The entire procedure, which might have taken 3 hours a decade ago, took Dr. Selznick just 1 hour. And following therapy, Santos's shoulder should be almost perfect.
Santos, everything went great. Okay. Hopefully we'll have you playing in 6 to 8 weeks. Okay? I expect that he's really not going to have problems with his shoulder in the future. He's learned that you have to warm up beforehand, stretch properly, not just his shoulder, but his whole body, and also to ice the shoulder when he's done playing, and do things to try and prevent re-injury.
The same type of injury High player Daniel Love is recovering from.
Pretty amazing with what he had that he came back at all, let alone to come back as one of the best in the world.
Does that hurt you?
But the rehabilitation process was tough, especially for Daniel, whose injury was more serious than Santos's.
Daniel worked 2, 3, 4 hours a day for 6 months to be able to come back. And that type of drive you don't see a lot.
This is actually more of a warm-up.
Daniel says he used to just come out and play, but now he's learned that extensive warming up can extend the life of his game.
I get into a routine that I do every day. You know, warm up, stretch out, maybe a little bit of weights.
My first couple games are always the hardest because that's when my body is cold and my arm hasn't had a chance to go through the motions. But my last couple games are always my better games.
As for Dr. Selznick, after being a High physician for 10 years, he's also become a big fan, too.
I love watching it. The real artistry in the sport.
After undergoing arthroscopic surgery in a Florida hospital, golfer Greg Norman was fast on the comeback trail.
I love to work out. I'm very committed. If I know I have to do something, I'm going to go do it, whether it's rehab from surgery or whether it's doing some work on the golf course or just doing business. I'm a very committed individual.
Most patients can't start playing golf for 6 weeks, but Greg wasn't willing to wait that long, so he pushed himself to the limit.
I started working out, riding a bike within a day or two. I got off my crutches a little bit earlier. I don't know whether that was the right thing to do or not, but I did because I wanted to make sure I could start walking and walking and walking, you know.
We had a combination of aquatic exercises and specific rotation control type of exercises, stationary bicycle, a lot of motion exercises, a lot of exercise focused on the hip, lower back, and lower abdomen.
The next step was getting back on the golf course.
I started chipping golf balls, I believe, within 2 or 3 weeks after.
3 weeks after that, he was playing in the 2000 International at Castle Pines, Colorado, where he finished 4th.
So it was an incredible success for me. I believed in it and worked.
7 a.m. at the Trump International Golf Club in West Palm Beach. The Health South trailer is open for business.
I just think it'd be a good idea to have Dr. Andrews look at it this afternoon.
Trainer Keith Kennedy runs the trailer.
We'll come up with something new and
offers advice on workouts and treats injuries.
Very typical, just blister and...
All in an effort to prepare these players to compete for top honors and the winning prize of $215,000.
We're trying to get these professionals ready to play golf, and so if that requires stretching, if it requires taking care of a blister so they can walk the 6.5 miles they're about to walk, you know, loosening up the shoulder.
I call Keith my doctor.
Lori Kane is an 8-year veteran who's suffering from a sore shoulder.
My arm's not going above my head these days.
She's been relying on Keith to help her keep the shoulder in playing shape for the last 5 months.
You know, it doesn't hurt to go back.
Right.
If Lori's rotator cuff is torn, she could be out of competition for the next 6 months, an absence that could cost her hundreds of thousands of dollars.
And it seems to have just flared up at the end of the year, and I think we're just going to get it looked at and see what we can do with it, make sure we're okay and ready to go in February when they start back up again.
Sometimes if you get your arm up in this position,
Dr. Jim Andrews, the medical director for the LPGA, works closely with Keith to diagnose problems
it doesn't hurt to swing the golf club, it just aches.
and keep their players on the course.
of course that's our job. That's what we're all looking for, so they can have fun and stay healthy and play 29, 30 tournaments a year. Is you need to get into all your internal, external rotator exercises.
Dr. Andrews determines that Lori's rotator cuff is sore, but not torn.
Smooth as a whistle.
With Keith, she hopes to prevent any severe long-term injuries by developing a workout program.
I look at myself and I know that, yes, I could be in better shape. And if I was in better shape, I wouldn't have these little nagging problems. You know, it could be the difference between winning a tournament and not winning a tournament.
They're trying to be as good an athlete as they possibly can. I also preach to them that it doesn't make them bulletproof. The injuries are going to show up, but sometimes it can cut down on recovery time, so it's well worth the effort.
Off Key West, high winds have stirred up a heavy chop, and the boats are having difficulty on the course. Several boats have already overturned and their crews plucked from the water. With even higher winds predicted, Safety Director Jim Poplin finally decides to halt the races.
The race is over. We are checker flagging boats as they cross the finish line.
For Jim, the accident toll was already high enough. He didn't feel he could take the risk of more.
This race was a very hard race. With the accidents that we've had 5 so far. That is a very high number, and it's the World Championship. So there's a little adrenaline factor there. There's a little bit more speed that's going to be involved, and we've had 5.
And 5 had already taxed his safety team to the breaking point.
My rule of thumb is once I get down to 1/3 of my resources, you know, it's over.
We are stopping the race at the start-finish. Let them come on to the start-finish.
Miami is a city built on fast times. The sun, the fun, and an endless stream of visitors who come to lap it up. In a place where the action is fluid and excess is easy, keeping pace with emergencies is a tough job. It takes a special breed to keep a lid on things. Men and women like the mobile medics.